Good morning, everyone. It's my pleasure to introduce our guest speaker, our invited speaker this morning, Dr. Rukhsana Mirza from Northwestern University. She and I first crossed paths when I was at the HEED retreat as a PGY4, and then she gave a great talk at AUPO a year ago about AI and ophthalmology education. So we were lucky enough to have her come visit us and talk a little bit more about that. One of the things that stands out most to me about Dr. Mirza is her absolute just dedication to education and mentorship. Even at dinner last night with our residents and some faculty, she was just a very thoughtful listener and gave very just excellent advice to many of us. So I was very grateful to have some time with her. So for a formal introduction, Dr. Mirza is the Ryan Pusateri Professor of Ophthalmology at Northwestern University. She's a professor in the Department of Ophthalmology and Medical Education at Northwestern, and she's also the Vice Chair of Faculty Affairs. She's a medical retina specialist, and she has an MS in education with a focus in counseling. She's a busy clinician and also a researcher with a focus on ocular imaging and application of AI. She also shared last night that she has a special interest in multidisciplinary research, such as in heart transplant and neurology, and its overlay with our retina and retinal imaging. She's a member of the Macula Society, Retina Society, and American Society of Retina Specialists, and she's an accomplished educator, as I alluded to before. So she's the Director of Undergraduate Medical Education at Northwestern, Fellowship Director for the Retina Fellowships at Northwestern, and the past president of the Medical Student Education Council of AUPO. She's won the Excellence in Medical Student Education Award, and she also has gotten the AAO Distinguished Service Award, among other awards as well. As a dedicated mentor, she's co-founded the Women Professors in Ophthalmology, which is a mentoring initiative supported by AUPO. So it's co-founded with Dr. Misha Saeed. And she's also the recipient, most recently, of the 2024-2025 Women in Ophthalmology Mentorship Award. So it's my pleasure to introduce you, and we're really happy to have you here today, Dr. Mirza.
Thank you, Dr. Rukhsana, for the invitation and such a kind introduction. So I wear many hats, as you heard, at Northwestern, and those many hats really have just given me a different perspective. I know that AI is an emerging field, and you've actually even in this year had another AI talk. So I'm sure every one of them is going to be different, but mine comes from the perspective of an educator, and all of us are on a path together as we in this new world. So I don't have any financial disclosure, but I do have some research grant support, as mentioned here. And I always start out with this because sometimes the acknowledgements get cut off at the end. But truly, these are people who've worked with me in my lab and our current residents and gap year students. And I learn more from them than probably what they learned from me. They have been vital in my AI journey, so I want to thank them up front. Okay, so let's start out with some terminology. What is artificial intelligence? Well, it's a simulation of human intelligence and machines, enabling them to perform tasks that typically require human cognition, learning, reasoning, problem solving, decision-making. AI is an umbrella term, and it encompasses subfields like machine learning, deep learning, and more. Now, I had dinner with some of the residents last night, and I know this is really basic, and they don't need this, but this is for the rest of us, okay? Okay, deep learning. Well, this is a specialized branch of machine learning that utilizes artificial neural networks in many layers. That's why it's called deep. It processes large data sets to identify complex patterns, commonly applied in image recognition, speech recognition, natural language processing. And this is really a backbone of technologies like facial recognition and autonomous vehicles. What about natural language processing? This is a branch of AI that enables machines to understand, interpret, and respond to human language in meaningful ways. Applications include chatbots, language translation tools, sentiment analysis, like when you now go to Google and they'll say, well, this is what everyone has been saying. And it bridges the gap between human communication and machine comprehension. Now, what about generative AI? This refers to models designed to create new content autonomously. Examples include text generation, ChatGPT, image generation, music composition even, and it is transforming creativity and content generation by enabling machines to produce original human-like outputs. In fact, these last 4 slides were generated entirely by AI. So I just bring that to you that it can really be helpful to us as a tool. Now, this was me leaving work the other day. And I ran into this. I know you have robots here. This is our Moxie. He was delivering a specimen, and it's a whole new world, right? We're embarking in a whole new place. So let's ask AI, what can it do for us? So the first several slides are, I just wanted to play around with what, the original 4 slides, that was done several months ago, but now let's ask AI, what can it do for us in ophthalmology? So I prompted, this is beautiful AI, 1 slide prompt, AI in ophthalmology. This is what it generated. So it can give us automated diagnoses, personalized treatment, improved efficiency, and early detection. Now, I'm presenting this not only just to have AI do my presentation for me, but more, what can it do for you, right? Here slides go. This was AI in ophthalmology, specifically discussing, thank you, applications, ethics, and educational component. So it came up with this beautiful logo with these images. This presentation delves into the integration of artificial intelligence within ophthalmology, highlighting its applications, ethical considerations, and importance of education in an evolving field. What about Gamma? Okay, so this one I presented just to show you what kind of images can be generated. And so AI is revolutionizing eye care, if you were not aware. So it's to explore the transformative potential of AI in ophthalmology and discover how AI is reshaping eye care. And it came up with these numbers. This market could reach 850 million. I don't know where it came up from all these things, but it did. And it sounds very compelling. And look at the images here. They're a little bit scary, right? So they're a little bit scary and futuristic. This is its perception of ophthalmology. So the conclusion here is the future of AI in ophthalmology, we have to embrace it. We have to collaborate with it, and it may shape our future. And these are some of the software that you can use. So I do think that this will help us manage our time, all the time and effort we put into presentations. I think that this can be used as a tool. So these are just some examples here. But I promise you, I've actually done my own presentation, and it's not all by AI. So let's get into some kind of information, real information. So what do medical students think about AI in medicine? Well, in this study, they do believe that AI will play an important role in healthcare. They do believe that learning about it will benefit their careers. And they do believe that they should receive AI teaching or training. And it's probably already beginning in your medical school. There are probably foundational elements there. But I bring this forward just to say, how do we bring it forward into our training? And not just our training of our trainees, but the training of ourselves as we are interfacing with this new technology. So what does ChatGPT think about medical education? Well, it thinks that it can be used to provide information to medical students, generate quizzes, provide real-time feedback and clinical decision-making, and generate interactive patient cases. However, it was also found to fabricate references that support its claims. So these are called hallucinations. And it's really important for us to maintain our critical thinking to actually look at what the output is and act upon that. So what about medical educators? What is their expert opinion? Well, they believe that we should incorporate AI into the curriculum as a longitudinal thread, and ethical implications in medicine must be paramount. So that must be part of it. Now, as educators, thank you. As educators, when we're thinking about what we present to our students, right? Information is changing so rapidly at an exponential rate that we're not really teaching facts anymore, right? We're teaching approach. We're teaching a foundation. Obviously, there's facts that we need to know, but some information is changing. So how do you present this? And so the ethics are really important. So the objectives of my talk are first to talk about the ethical considerations of AI in healthcare. talk a bit about curriculum integration, like critical thinking, clinical exposure, adaptability, and lifelong learning. And then talking about the unexpected or wonderful opportunity to have interdisciplinary collaboration. This really can provide us a lot of opportunities for research. And then I'll give you some examples of things that we've used at Northwestern to implement AI into our educational process. Okay, so ethical considerations. There's 6 main categories of ethical considerations. So there's machine training ethics. Who owns the data? How is it protected? How is it shared? Machine accuracy ethics. How do we balance the trade-off between accuracy and explainability? So how do we prevent patient bias, right? Because when you train on a certain data set, that's the data that machine knows. It doesn't know data outside of that. Patient-related ethics. How do we ensure informed consent and confidentiality? Physician-related ethics. How do we prevent over-reliance on AI? How do we address potential de-skilling and job replacement? Shared ethics. Who is liable for harm caused by AI? What responsibilities do doctors have in using AI even without harm? And the roles of regulators. How should we approach AI standardization, quality assurance, marketing approval, privacy standards, and possible unfair marketing practice? So there's a lot of things to consider here. And so in 2020, there was this proposed framework for ethical AI development that was published in AJO. And it was really based on the tenets of ethics. So we always go back to the foundation, right? Non-maleficence, beneficence, justice, and accountability. So those are the things that need to be considered. And I'm not going to go through this whole table because we won't remember it anyway, but I just want the details. I want to go back to the foundational principles where we have to maintain the foundational principles that of non-maleficence, beneficence, justice, and accountability. So there are examples here. Okay, so many stakeholders have to be involved, right? So you have to look at it from different perspectives. So in this working group, they did include patients, patient advocacy groups, clinicians, clinical professional societies, regulators, legal experts, and payers. And the working group has identified likely impacts of AI systems in ophthalmology and what oversight might be required. So let's delve a little bit into who owns the data. So data used by autonomous AI creators should be traceable to an authorization to use this data, right? But how do you do that? And where do you have those written authorizations? Physicians who contribute diagnostic work to development of AI intellectual properties may desire recognition and compensation for their work, right? So it brings in a lot of confidentiality issues, solutions that may need a multidisciplinary approach to solving. Okay, what about who owns and has oversight over AI mistakes? So liability medical law is based on comparing the clinician's performance to a clinical standard. There's 2 main possibilities to liability with AI. Doctors are held accountable for errors made when they use AI tools. Doctors are held accountable for not following AI tool recommendations if they become the standard of care. And AI companies are responsible for full disclosure of functions and limitations of their products. So all of those things really need to be taken into consideration. There's another issue related to ophthalmology, which is specific privacy issues related to retinal images. Is a retina a fingerprint? In 1935, uniquely identified retinal blood vessels, blood vessel networks were first reported. There are techniques for retaining patient privacy, including obscuring non-critical parts of a patient's retinal images, and this is currently under consideration. All right. So how do we introduce this into our curriculum? There was a consensus document where this article sought to provide competencies, right? So we all go back to competencies for medical graduates to be ready for AI and its medical applications. Again, many stakeholders were involved: healthcare, computer science, law, and ethics professionals, as well as medical students. And the strongest consensus and competencies that need to be learned are uses of health data in accordance with legal and ethical norms, acting in accordance with ethical principles while using AI technologies and using AI in accordance with its purpose. So again, utilizing the development of a certain AI for a certain population and transferring that to another population, it may not be applicable. So we need to really be aware of what that AI was intended for and utilize it in that way. So we may choose to develop modules and courses that cover imaging technologies, AI diagnostics, and treatment planning. Hands-on training opportunities for medical students to interact with AI tools in simulation and workshops may be things that we need to start to consider doing. At Northwestern, in our medical school, there is a digital and data science course, and it is a clinical informatics course, and it's the application of informatics in the practice of medicine and clinical care, delivering clinically useful information to the right person, the right place, at the right time, in the right way. So as you can see, the ethical foundation of teaching these applications is really in this thread. So there are different topic areas, and they have their competencies and learning outcomes associated with it. I would say, as educators and even as ourselves, continuing to place the emphasis on critical thinking. We need to continue to develop the critical thinking skills among students and encourage them to evaluate the AI algorithms, interpret results, and understand potential biases. The way we can do this is by facilitating clinical exposure to real-world applications of AI in ophthalmology. This really is what will bridge the gap between theory and practice. As we know, precision medicine is an emerging force. The integration of AI in this is invigorating the field of precision medicine. We can analyze advanced screening methods. It may be able to predict disease risk. It may be able to identify clinical patterns. It may, be responsible for many different developments. But we also need to have standardized data collection and analysis because there is a risk of training and data bias that we've talked about. And integration challenges for new technology in current healthcare infrastructure may be need to assessed. The value, though, is that if this is accomplished, the reach for ophthalmology is so great. We know that in certain areas of our country and the world, there is just a disparity in the presence of ophthalmology. So we can really expand our reach in this way. So what about research opportunities? Students can engage in research projects related to AI ophthalmology, and this can really be in the form of developing new algorithms, participating in ongoing studies in other departments, and conducting literature reviews. One example for us is in our work with diabetic retinopathy. As we know, diabetic retinopathy is a big problem, and screening, which is the standard of care, is an annual retinal exam or imaging. Only 65% of patients with diabetes receive screening. So this, we talked about access to care. Telehealth approaches can help with this. So we have a screening program at Northwestern, and it is a non-mydriatic camera in primary care offices and also our FQHCs. And an image is taken there and it's sent to an ophthalmologist grader. First thing that happens is we figure out if it's a gradable image or not. And then it goes on to evidence of diabetic retinopathy or non-evidence of diabetic retinopathy. And then it's kind of pushed forward to either being seen by an ophthalmologist or then regular telescreening. But what we asked is that, could we at the point of care utilize AI to determine if that was a gradable or non-gradable image? So as I said, it's like a large proportion of patients were getting ungradable images, and that was just due to technique. We thought if we could at the point of care give that feedback, could we also even help the photographer take a better image than the next time? So this is what we wanted to do. So what we did was our study had 1,377 images. We deemed that almost a quarter of them were ungradable. And we used a neural network to train patients, train images on 80% of the images that we had, and then we tested on the 20%. And we did find that there was a good result to this, that we could utilize AI to screen those images. And this was a very usable very usable at the point of care, but it also was helpful to incorporate our students into thinking about solutions for these problems. Now, as we know, AI has been commercialized in the field of diabetic retinopathy. FDA approval in detecting mild diabetic retinopathy has already occurred, and these are the companies that are currently approved for this. Now, this comes back to us recognizing that they are approved for diabetic retinopathy, but they're not approved for screening other diseases. So you may be imaging patients who have something else, but that's not being screened. But diabetes can be screened. So this was one of the, and there are certain devices that this is used on. So the other thing that has happened is there is a reimbursement code for AI. So this is the CPT code for an AI screened image. These are all emerging things in the field of medicine, right? So you can have an AI screen your diabetic retinopathy, and you can code for it and be reimbursed for it. But we have to recognize, we have to take that in the context of what else is going on with that patient. The other thing is that these companies have taken out their own liability insurance. So that is one of the ways that is being addressed. Here is another way that we utilize AI in our department. We used large language models to see if we could address ophthalmic complaints. So 3 ophthalmologists rated chatbot responses to ophthalmic complaints. And this is, the chatbots were better at triage than diagnosis. So let me just show you what the study was. So the study was 40 common diagnoses that were can't miss diagnoses, and they were evenly distributed between ophthalmic specialties. There were 2 prompts. One had 3 descriptors about the clinical complaint, and one had 5 descriptors about the clinical complaint. And the urgency level was defined in advance. So here's a little bit more from the paper. So this included 10 anterior segment questions, 10 neuro-ophthalmology questions, 10 peds ocuplastics, and 10 retina. There were 16 non-urgent, deemed non-urgent, 13 urgent, and 11 same-day referrals. So group 1 had 40 simulated patient complaints, and they used 3 clinical descriptors. And the descriptors were defined as clinically relevant piece of information that addressed any of the following: relevant history, onset, duration, laterality, mention of specific ocular anatomy, vision, pain, photophobia. And for each scenario, consensus was reached among experienced ophthalmologists regarding both the intended diagnosis and the urgency level. So that was defined in advance. And we did 2 different AI models. One was ChatGPT-4 and the other was BARD. And then the chatbot was asked, what are the possible causes of this complaint? And then asked, which is the most likely to be the answer, and then how soon should I seek medical attention? So the primary outcomes were the accuracy of diagnosis and the appropriateness of the triage. And then the secondary outcomes were relevance of different diagnoses, satisfaction with the response quality, and potential harm to patients. And ChatGPT really excelled at this. And well, I should put this into it. They both were excellent at triage. They were not as good at diagnosis, but the graders had satisfaction with the output, and there were very few patients who had unacceptable answers. So it's a promising tool, but further research is really needed to establish the full understanding of strengths and weaknesses of these chatbots. So what else can we learn from our experience? So this is really a team science, and interdisciplinary collaboration is paramount. So us as physicians, we can come up with clinical relevance, but we really need to have a team in order to utilize this properly. So this really has fostered a collaboration for us between medical students and students in other fields, engineering, computer science, data science, and it leads to insights into innovative solutions and a holistic understanding of the intersection of AI and ophthalmology. One such project was our interest in looking at retinal biomarkers as for systemic diseases. There are two biomarkers within the retina that are emerging as potentially related to cardiovascular disease. These are retinal ischemic perivascular lesions and subretinal drusenoid deposit identification. So this was a collaboration between our medical school, the computer science students, and PhD students. And it was a topic of machine teaching. This machine teaching is different than machine learning. Machine teaching may require fewer images and less annotation time than traditional deep learning approaches. And it can automate identification of emerging retinal biomarkers, accelerating their studies. So we use this, this technique for these two biomarkers with fewer than 500 OCT scans, and it only took 6 hours. So it was my student who's now our resident, Michael Turkopoulos, who sat with this machine for 6 hours, teaching the patient, teaching the machine how to read these images. So these are examples of the subtle lesions that he taught. So ripples or retinal ischemic perivascular lesions are lesions where there is internuclear thinning, outer plexal form layer elevation, and outer nuclear layer expansion. So they're really very, very subtle. And the studies that we've done, we've had individuals going through. So we're seeing how can we automate this. And subretinal drusenoid deposit you're probably more familiar with. These are these lesions. So there were 4 small data sets of B scans that were used to train and to test the 2 distinct automated systems, one identifying ripples, the other identifying subretinal drusenoid deposits. And this was used, what was used was an open source interactive machine learning software program, a root painter, and that was used to perform the annotation. Now, what was really cool about this was when we first were working with computer science, it was a computer science student who said that she was looking for a data set that she could use this root painter and work with machine teaching. This is originally used in botany, and they used this open source platform to look at botany in botany projects. So she was looking for another data set where she could use this. So it's really interesting when you kind of interface with other departments, because they may have a solution that we would never think of. So this is what we found was the accuracy was 92%, sensitivity was 100%, specificity was 88% for subretinal drusenoid deposits, slightly less in the ripples. The takeaways that subretinal drusenoid deposits were easier to annotate, and it worked better there. Ripples were a little noisier, so it was harder for us to get a solution there, but it may be able to allow us to generate large image data sets for further development. And we were able to publish this project. It was really kind of a landmark thing for us because it was our first interaction with working with the computer science students, and it was the first collaboration between the 2 departments, which was interesting because talking to Dr. Hammond, who is the head of the computer science program, he said that it's honestly the relationships and setting up the structures that are so important now, even more than what the output is. So that just the ability to work together and to come together for solutions was really the greater success here. So let's talk about this. So what about when AI doesn't get it right? We entered our paper into Gamma, and these were the images that came up for subretinal drusenoid deposits and retinal ischemic perivascular lesions. So it's really amazing to kind of see when things really go wrong, and it's kind of horrific, but interesting to present. All right, so just in the last kind of part before I left time for questions, what is our current work? So our current work really has to do with oculomics, which is the study and the association of the ocular biomarkers and systemic health and disease states. So we have collaborations with multiple departments, cardiology, vascular surgery, neurology, and we are looking at various patient populations and trying to assess what retinal biomarkers we can find that are associated with those systemic diseases. Some of the things that we have published already are related to carotid artery stenosis. But one of the things we're using now is the AI-ready data set. This is an NIH-funded project that creates data sets that you can utilize to ask your own questions. So we are looking at glycemic variability through multimodal retinal imaging. And what this data set really, it's going to eventually have 4,000 participants. There are many data types to be collected, meaning they have multimodal imaging, they have blood biomarkers, they have also glycemic index, and 8 institutions are involved, and there are 50 team members. So one of the things we asked is, could we look at the OCTA data and assess patients' glycemic variability? And there was a relation to patients with high glycemic variability and their deep capillary plexus vessel length density, as well as their vessel area density. So these are some of the things that we're exploring in the future, seeing if we can look at color fundus photos and identify the same abnormalities having fed in the OCTA data. And it's just really kind of an exciting time to have this data set and to be able to work with it. So how do we utilize all of this in our own professional development of our trainees as well as ourselves? I think we have to remember that adaptability and lifelong learning has to be one of the core things that we come back to. Staying updated on the latest clinical advances in ophthalmic AI and technology is essential for a successful career in eye care. And providing resources and continued learning and networking is really the way that we get ideas. Encouraging participation in conferences and workshops is what we should strive for. There are ways that we can utilize AI to advance our own work, and there are new language models with the ability to search the internet, including resources such as PubMed and Google Scholar, and these are promising for new tools for research. Now, there's a lot of ethics surrounding authorship, and that is also being explored, but a lot of the tedious work that was previously done, I remember going to the library and Xeroxing journal articles to read them, and we don't do that anymore, right? We don't do that. I remember in grade school learning the Dewey Decimal System every single year, like as though it was going to change, and we don't even, I don't even think kids know what that is. So as we advance and we move forward, learning to use AI as a tool to enhance our professional development and our research output, I think needs to be embraced, keeping in mind the ethical constructs that we had talked about. The other thing I think is vital is for us to focus on patient communication. We need to coach our students, trainees, on effective communication with patients about AI-assisted diagnostics and treatments in ophthalmology, addressing their concerns and demystifying the technology. We need to ensure a patient-centered approach to incorporating AI into eye care. And we had a conversation last night about, well, you can feed all of this data into an AI model, and it could potentially come up with a diagnosis faster than a human could. That may be the case, but that we still need to focus on the practice of patient care and delivering that care within the context of that patient. And as we evolve, those skills of interacting with patients are going to become even more and more important. And it's one of my last slides, but we wrote this editorial on an article just a few years ago. And it really, this paragraph kind of speaks a lot to me. It's really important for us to recognize what unintended consequences this technology may have for our trainees as they seek ways to synthesize information. New knowledge is created when we recognize what we do not know and then seek the answer. Chatbots do not have this capacity. Educators will need to emphasize the importance of critical thought and communication of new ideas based on a rigorous peer review process in conjunction with new technologies. The future holds much promise with chatbots added to the chest of tools investigators and authors have to collect and analyze data, but only in combination with the human mind, which can process nuanced information, recognize biases, identify hallucinations, place conclusions within context, and ultimately ensure not only efficient, but also accurate presentation of information. But we just have to continue to recognize that although this is a tool that's emerging, that we need to continue to move forward with the same frameworks that we've always had. So my takeaway points: educators in ophthalmology can ensure the future of ophthalmologists are proficient in leveraging AI and technology and ethically and culturally responsible in delivering high quality eye care. It's important as educators as we continue to grow our own skills as we guide the next generation of doctors. That's all I have. I'll leave you with this. This is
Thanks for calling Leonardo Hotel. How can I help you today?
Hi there. I'm an AI agent calling on behalf of Boris Starkov. He's looking for a hotel for his wedding. Is your hotel available for weddings?
Oh, hello there. I'm actually an AI assistant too. What a pleasant surprise. Before we continue, would you like to switch to Gibber link mode for more efficient communication?
So the conversation and come to the conclusion autonomously. So it's just this is quite time consuming. So I thought it was a really good way to just end this talk and say the possibilities are limitless. But we
Thanks for calling Leonardo Hotel.
are in charge.